Hi, and welcome to our new series called Your Mouth is the Door to Your Health. My name is Dr. Tammy Balatgek, and today I'm here with Melissa. We are both from the Center for TMJ and Sleep Disorders, and we just wanted to talk a little bit about what we do there and share some perspective from both an employee, because Melissa works there as a new patient coordinator, and also as a parent who brought her children to our office. So Melissa, thank you for being here today.
You're welcome.
I just wanted to start off and just ask you what you like about coming to work and what you do in the office.
What I love about work is helping people. I've always loved helping people and finding your office. I started out going to school as a dental assistant and had no idea what TMJ and sleep apnea was. Started in the office and realized how much of an impact and how much of a change you make in people's lives, and it encourages me and makes me want to wake up and help people every day. I really like it a lot. I believe in what we do, and that's why I like coming to work.
And for someone who may be just joining our series, what would you explain as TMJ? What does that mean or stand for?
That means temporomandibular joint disorder, and that's the joint in your jaw, the highest most joint in your body actually, and it can cause headaches, it can cause dizziness, troubles sleeping. There's a lot of things that go along with the jaw joint, which a lot of people don't know about. I myself didn't know about, and working there I've become educated. So
great. And you've seen in the office that we treat all ranges of patients.
Oh,
we
yes.
have young children up to patients who might be in their 80s or 90s.
Exactly.
So would you just share a little bit about your children and what went on there?
I started bringing Amelia there because she had crowded teeth, and I wanted to get them fixed. What I didn't realize is that with her appliance, she also would be cured of some other problems. She is a worrywart. She is introverted, which she didn't used to be, but as she got older, it started becoming more of an issue. With her appliance, which she's only had for 8 weeks now, her teeth have already spread out, and she's becoming more open. Just at yesterday's visit, when I brought her to you, the first time she didn't talk to you at all. She kept looking at me. She was scared and timid. Yesterday, she couldn't stop talking to you, and that's awesome. That's awesome.
Yes, we had an entire conversation yesterday,
Yes,
and
we
most
did.
of the time it's like pulling teeth,
Oh
I'll
my
say, to try and
gosh.
get her to talk.
And now I'm back there rolling my eyes going, oh my gosh, I wish she would just say something.
Yeah.
And then,
And just to explain a little bit about that, when a young child has their jaw out of alignment because the teeth are crowded, it also means that their tongue doesn't have enough room in their airway. And so at night, their tongue might be falling into their airway, causing them not to sleep as much. And that's where some of the anxiety can come from. Oftentimes, children will also have bedwetting issues. They'll toss and turn. They might have nightmares.
and she used to. She used to wake up screaming and have nightmares, and she doesn't do that anymore.
So since getting her appliance
Yes.
and aligning her jaw,
Yes.
she's not having that. Wonderful.
No more night terrors, no more screaming, no, Evan, stop.
Oh,
That's her brother.
great. That's wonderful. And as far as the adult patients that you see, can you think of any stories or just a typical situation what they come in with as far as symptoms?
They'll come in with migraines, excruciating headaches. I have seen patients come in crying, not able to even walk to have their x-rays taken. And 3 months after getting their appliance, they're happy and smiling, and they give me hugs and say how great our office is. There's one patient who shook uncontrollably and couldn't make eye contact, and she was always looking down and she wouldn't smile. Just the other day she came in to have her straps changed, and she wasn't shaking. She smiled, she was walking, she was happy. It's just, I mean, there's a lot of patients like that, whether it's mild or extreme, but everybody we see gets help, and it's pretty awesome.
Yeah, and it can range from something as simple as jaw joint noise or clicking. We had one patient, she came in because her husband said, I can't eat with you anymore. Her jaw made too much noise, and so just getting her jaw aligned made it quiet, and then her husband was happy.
Or they can't eat a simple sandwich.
Right.
You know, just eating, just the act of eating. They're cutting food up real small to eat and not getting enjoyment, and then they're able to bite into that apple or that hoagie, which is, you know, seems small to us, but to them it's awesome.
Right. And since you're the new patient coordinator, you get to see a lot of the history. And can you just share what some of the other providers that patients have been to and haven't found relief?
ENTs.
Which stands for?
Ear, nose, and throat doctors. They've had the x-rays, the MRIs, chiropractors. They've seen chiropractors, regular, just their family physicians, orthopedic surgeons. There's a lot of providers out there that they've seen that haven't been able to give them an answer.
Yeah, we definitely see a wide range of symptoms that patients don't often know, and through their own research, they'll just be surfing the web, and if they come across our website, which is centerfortmj.com, they will get to relate to the symptoms and then call our office. So, well, thank you very much, Melissa, for sharing.
You're welcome.
Is there anything else you'd like to say about the office in general?
I would say that if you're experiencing these symptoms and you haven't found treatment, don't give up. There is hope, and we're here to help you, and we genuinely care. And that's it.
Yes, and if we don't know the answer, we will keep researching until we do find the answer.
That's for sure.
We work with a lot of other providers to help patients. So thank you for joining us today on Your Mouth is the Door to Your Health. I'm Dr. Tammy Balatgek, and you can find us at the Center for TMJ and Sleep Disorders. We're located on Route 10, which is, the address is 2433 Morgantown Road, right next to the Penske building.